Hey everybody, welcome into the channel. A congresswoman just called RFK out for some of his outlandish comments when it came to black and brown medical issues. And we just gonna jump right into it because it just sounds crazy to me. I couldn't understand where did he get this from. So let's see what she gonna say. Let's see. Let's get into it.
Mr. Secretary, you've made a number of outlandish and frankly disturbing comments both before and during your tenure as Secretary of Health and Human Services. I want to draw your attention to one of those times. In a 2024 podcast interview, you suggested that Black children on ADHD medication should be reparented. You said every Black kid is now just standardly put on Adderall, SSRI, benzos, which are known to induce violence, and that those children are going to have to go somewhere to get reparented. There is a lot to unpack in that comment. I know that you've already answered several of the questions I was going to ask, and so I'm just going to rephrase them. Mr. Secretary, you've already admitted that you are not board certified physician, and you've already admitted that you did not go to medical school. Have you ever reparented, or parented, I should say, a Black child?
I don't even know what that phrase means, and I doubt
Just a
that I
yes or
said
no
it.
answer.
I doubt that I
did
said
say
that
it.
phrase.
You
No,
absolutely
I'm not
said
going to answer something that I didn't say.
You absolutely said it.
Oh, I'd like to hear the recording.
So to be
Because it
clear,
doesn't make
sir,
any
I'm
sense.
I'm
I
gonna
don't even know
reclaim
what
my
it
time.
means.
I don't either. That's why I'm
And
asking.
by the way,
So to be
of
clear, you're not a
26
doctor, you have no medical degree, and you have no formal medical training.
as
And
have
you have never
as have
parented a Black
as have
child. And yet you
24
are
of the
suggesting
26
that
HHS
government-
secretaries
Mr.
have not had
Secretary,
medical
This is my
degrees.
time. And I say to the chairman, I want to reclaim my time. So you are not a doctor, have no formal medical training, and you've never parented a Black child, and yet you are suggesting that the federal government should take Black children away from their families and reparent them and send them off to some wellness farm instead of providing them with evidence-based.
You're just
medical
making
care.
stuff up.
I am absolutely not making this up. Mr. Secretary, in your opinion, what factors should the federal government consider when reparenting a Black child who has been on ADHD or ADD?
I don't even know what you're
sir.
talking about, Congressman.
I
don't know what you're talking about. I don't know what reparenting
disorder,
even means.
I don't either, but you said that.
I did not
Mr.
say that.
Secretary, for Black families in the United States, the issue of family separation is not new. Our nation has a long and painful history of separating Black children from their families. During slavery, Black children were taken from their parents and sold with no regard for their humanity. And after slavery, Black families continued to face forced separations through Jim Crow laws, discriminatory policing, and child welfare systems that too often assumed that Black parents were unfit.
Let's make this clear. This is wildly inappropriate because we're not talking about some random person on the internet saying something reckless, because I know y'all, a lot of y'all say some reckless stuff. We're talking about the Secretary of Health and Human Services. And that's not a little job. That's not a figurehead position. That is the person who is responsible for policies that affect families, children, healthcare, mental health, and everything. And somehow we're sitting here having a conversation about whether this man suggested that Black children need to be reparented. Do you understand how crazy and wild that sounds from the Health and Human Service Secretary? We knew that he was less than qualified. This puts you all the way off the board, bro. All the way off the board. You cannot, and I suggest this a lot, you cannot be in a position like that and have loose, unclear, or bizarre language floating around about Black families and Black children. You just can't. That's unacceptable, because this country has a history. Not a small one, not a footnote, a long documented history, painful history of separating Black children from their parents and justifying it with language that sounded official, scientific, and concerned, just like she said you said. Slavery did it. Jim Crow policies did it. Even modern systems have been accused of doing it through bias, through assumptions, through overreach. You need to figure out where you said something like that from, Secretary of Health and Human Service, and then you need to figure out how to get it erased up off the internet for saying that kind of stuff. So when a high-ranking official is even connected to language like that, reparenting Black children, what is going on? That's not just a bad choice in word. That hit a nerve. That's wildly unforgivable language. Ain't no way in hell you should be no Health and Human Service Secretary. Okay? Instead of immediately clearing it up and explaining it and owning it and correcting it, we get this confusion. I don't know what you said. I ain't said that. I don't know nothing about that. She just came up there and lied on you, huh? She just came up there and said something that you didn't say. I don't know what that means. I didn't say that. Don't make sense to me. Now listen, if you're in that position, you don't get to be unclear about anything. You don't get to be vague. You don't get to act like words don't matter. You don't get to act like you don't understand what was said and when was said. Because in your role, words are policy before policy even happened. And people think like that. They got that goofy shit. He's one of those people. He's one of them goofy people who think like that. That think if you stick a Black person with a needle, they don't hurt. If you give them less pain medication, they only need less pain medication because they don't hurt as much as white people. Make that shit make sense. That we got a Health and Human Services secretary who is a goofy. People start to listen and start shaping these ideas, these decisions and directions off their dome, off what you say. So if there's even a hint of something that sounds crazy like that, like take your kids away, families aren't capable, or we need to intervene in Black household, you better shut that shit down immediately with precision and clarity. Don't stand there. I don't know. Not confusion, not dismissal, clarity. You just accuse this woman of up here lying. You need to figure out, and you need to ask your staff, did I say that? I would never say that. If I said that, then it must have been in some other context or blah, 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 or blah, blah, blah. But that ain't what you're saying. What you're saying is she lying. Okay. Also, it calls into question your expertise. Now, this is true. Not every HHS secretary has been a doctor. That's true. That's not the issue. The issue is this. If you're not coming from a deep medical or clinical background, then your responsibility to be careful, informed, grounded in evidence should be even higher. Because now you're relying on your judgment, not the science, and you're relying on how people interpret the data, the things you say, how you present it. And if that judgment starts drifting off in the strange, never, goofy land, unsupported or harmful territory, people are going to question whether you should be in that seat, dude. And they should. That's not disrespect. That's accountability now. Let's bring it back to what was really said. Black families are not some experiment. They're not a problem to be fixed. They're not a category that needs special intervention based on stereotypes or assumptions, dude. They're families, raising kids, navigating systems, doing the same thing every other family is trying to do, survive and take care of their kids. So when language even suggests otherwise, it doesn't come off as innovative. It comes off as ignorant as hell. Some of y'all goofies think like that. And ignorance at that level, it shouldn't even be there. It's not cute. It's not harmless. It's dangerous because it shapes how policies get written, how resources get distributed. You think like that? That's what you think? Reparenting? This is how communities get treated sometimes. And let me say this too. People in power don't get graded on intention. They get graded on impact. So even if you meant something else, Secretary, Health and Human Services, RFK, even if you meant something else, even if you think you were misunderstood, the question becomes, why was that even possible for you to be misunderstood? Why did your words leave room for that interpretation, that misinterpretation? That's where the responsibility comes in. And that's why moments like this matter, because they reveal something deeper, a disconnect, a gap between authority and understanding. And when that gap exists in someone making decisions about public policy, health, and families, there's a problem. I got a problem, a serious problem with this man. So no, this isn't just political theater. Y'all better stop it. This ain't just back and forth in a hearing. This is about whether the people in charge actually understand the weight of what they say and who is affected when they say it. And right now, that question feels very much open when it comes to this RFK Y'all better quit playing with me. If you all like this commentary, please comment in the comment section, and I will see you all in the next one.